Chapter 31 Sleep. Physical and emotional health depends on adequate sleep and rest. Without the proper amount of rest and sleep, the patient's ability to concentrate, make judgments, promote healing, and participate in daily activity decreases. While caring for patients, you need to individualize an approach to sleep and rest based on the patient's personal sleep habits and pattern of sleep to provide effective sleep therapies. Sleep is a physiological process that alternates with longer periods of wakefulness. The sleep wake cycle influences and regulates body functions and behavioral responses. Circadian rhythm is everyone's day night 24-hour clock. This is why we need to pay attention to the patient's work, school, and life patterns and be aware of how they are affected when hospitalized. Every person has a biological clock that is normally synchronized by the exposure to light and activity. This explains why some people fall asleep at 8 p.m., where others go to bed at midnight or early in the morning. Different people also function best at different times of the day. Factors such as social activities and work routines affect circadian rhythm and daily sleep wake cycles. Hospitals and extended care facilities do not usually adapt care to an individual's sleep wake cycle preferences. When the sleep wake cycle becomes disrupted, other physiological functions change as well. Decreased appetite, weight loss, anxiety, restlessness, irritability, and impaired judgment are common symptoms of sleep cycle disturbances. The control and regulation of sleep depends on a balance among regulators within the central nervous system. Changes in the peripheral nervous, endocrine, cardiovascular, respiratory, and muscular systems will affect the patient's sleep pattern. The major sleep center is located in the hypothalamus. Instruments such as the EEG, which is an electroencephalogram, will measure electrical activity in the cerebral cortex. The EMG, or electromyogram, will measure muscle tone, and the EOG, the electrooculogram, will measure eye movements, provide information about some structural physiological aspects of sleep. The hypothalamus secretes hypocretins, a form of peptide that promote wakefulness and rapid eye movement sleep, or REM sleep. Researchers believe that the ascending reticular activating system, or the RAS, located in the upper brainstem, contains special cells that maintain alertness and wakefulness. The homeostatic process, which primarily regulates the length and depth of sleep, and the circadian rhythms, which influence the internal organization of sleep and timing and duration of sleep-wake cycles, operate simultaneously to regulate sleep and wakefulness. Time of wake up is defined by the intersection of process S, which is the homeostatic process, and process C, which is the circadian rhythm. Shown above in Figure 31-1 is the two-process model of sleep regulation, which shows the time course of the homeostatic process, again process S, and the circadian process, again process C. Process S rises during waking and declines during sleep. The intersection of process S and process C defines the time of wake up. So let's take a look at a case study. Mary is a spouse of Walter Murphy, who is our patient. He's 82 years old and has resided in the local nursing home for the past 3 months. His wife still lives at home but visits Walter on a daily basis. Walter is confined to a wheelchair as a result of osteoarthritis and a mild stroke he experienced 1 year ago. Even though he has physical limitations, he is alert and oriented. Over the past several weeks, Mary found her husband to be very sleepy when she was visiting him just before lunchtime. Walter tells Mary that he has trouble falling asleep at night, and once he does fall asleep, he reawakens frequently during the night. Mary's concerned because her husband does not seem alert or interested during her visit. So, what type of concerns do you have for Walter, and how would you assess his sleeping pattern? Well, one of the concern is that Mr. Walter is not getting enough rest, and that can lead to impaired judgment. That may result in injuries and impedes his body's ability to rejuvenate itself. Mr. Murphy's sleeping pattern can be assessed by a sleep study. Normal sleep involves two phases: non-rapid eye movement, or NREM sleep, and rapid eye movement, which is REM sleep. During NREM sleep, an individual progresses through 4 stages during a typical 90-minute cycle. In box 31-1 in your textbook, you'll find a description of the stages of the sleep cycle. The quality of sleep from stage 1 through 4 becomes increasingly deep. Lighter sleep is characteristic of stages 1 and 2 when a person is more easily arousable. Stages 3 and 4 involve a deeper sleep called slow wave sleep, from which a person is more difficult to arouse. REM sleep is the phase at the end of each 90-minute sleep cycle. During REM sleep, there is an increased brain activity associated with rapid eye movement and muscle tonia. Normally, an adult's routine sleep pattern begins with a pre sleep period, during which the person is aware only of a gradually developing sleepiness. This period normally lasts 10 to 30 minutes. Individuals experiencing difficulty falling asleep often remain in this stage for an hour or more. Once asleep, the person usually passes through 4 to 6 complete sleep cycles, each consisting of 4 stages of non REM sleep and a period of REM sleep. Each cycle lasts approximately 90 to 110 minutes. The cyclical pattern usually progresses from stage 1 through stage 4 of non REM sleep, followed by a reversal from stage 4, 3 to 2, ending with a period of REM sleep. With each successive cycle, stages 3 and 4 of non REM sleep shorten and the period of REM lengthens. REM sleep lasts up to 60 minutes during the last sleep cycle. Not all people progress consistently through the usual stages of sleep. The amount of time spent in each stage varies. The number of sleep cycles depends on the total amount of time that the person spends sleeping. What is shown here is figure 31-2, which is the stages of an adult sleep cycle. The primary function of sleep is unknown. One theory suggests that it is a time of restoration and preparation for the next period of wakefulness. During non-REM sleep, biological functions slow. During sleep, a person's heart rate can fall to 60 beats per minute. Sleep is important to the preservation of cardiac function, as well as to decrease respirations and blood pressure and to relax your muscle tone. Sleep allows the body to restore biological processes. During deep, slow wave non REM stage 4 sleep, the body releases human growth hormone for the repair and renewal of epithelial and specialized cells such as brain cells. Protein synthesis and cell division for the renewal of tissues also occurs during rest and sleep. The basal metabolic rate lowers during sleep, which conserves the energy supply of the body. REM sleep appears to be important for early brain development, cognition, and memory. Sleep deprivation affects immune function, metabolism, nitrogen balance, protein catabolism, and quality of life. A loss of REM sleep often leads to confusion and suspicion. Prolonged sleep loss alters various body functions, such as mood, motor performance, memory, and equilibrium. The dreams of REM sleep are more vivid and elaborate than those of non REM sleep, and researchers believe them to be functionally important to learning, memory processing, and adaptation to stress. The interpretation of dreams oftentimes will help patients resolve personal concerns of fears. Personality also influences the quality of dreams. Most dreams are forgotten. To remember a dream, a person must consciously think about it upon awakening. When people are at rest, they usually feel mentally relaxed, free from anxiety, and physically calm. Rest does not imply inactivity, although people often think of it as settling down in a comfortable chair or taking a brief nap. Sleep is a recurrent altered state of consciousness that occurs for sustained periods. When people get proper sleep, they feel that their energy has been restored. Sleep provides time for them to repair and recovery of body systems for the next period of wakefulness. Adequate quality and quantity of sleep contribute to optimum health. Sleep duration and quality will differ across the lifespan. In adolescence, shortened sleep times often result in excessive daytime sleepiness, which frequently leads to reduced performance in school, vulnerability to accidents, behavior and mood problems, and increased use of alcohol. In middle age, the amounts of stage 4 sleep begins to fall, a decline that continues with advancing age. A number of factors affect the quality and quantity of sleep. Often, several factors contribute to a sleep disorder. Physiological, psychological, and environmental factors will inhibit sleep. Table 31-1 in your textbook will provide a list of illnesses and conditions that can alter sleep. And in box 31-2 in your textbook, you'll find a description of the effects of medications and other substances on sleep. So let's try a question. A 4-year-old pediatric patient resists going to sleep. To assist this patient, the best action to take would be A. Adding a daytime nap, B. Allowing the child to sleep longer in the morning, C. Maintaining the child's home sleep routine, or D. Offering the child a bedtime snack. The answer is C, maintaining the child's home sleep routine. Insomnia, the most common sleep disorder, is a symptom patients experience when they chronically have difficulty falling asleep. Sleep apnea is a disorder characterized by the lack of airflow through the nose and mouth for periods of 10 seconds or longer. Three types of sleep apnea are known: central, obstructive, and mixed. The most common form is obstructive. Excessive daytime sleepiness, or EDS, is the most common complaint. Narcolepsy is a dysfunction of mechanisms that regulate the sleep and waking states. There are two narcolepsy states, with or without cataplexy. Cataplexy is a sudden muscle weakness during intense emotions such as anger or laughter that occur at any time during the day. Sleep deprivation is a problem many students experience as a result of sleep disorder. Causes include fever, difficulty breathing, pain, emotional stress, medications, and disturbances in the healthcare setting. Hospitalization makes patients prone to sleep deprivation caused by environmental noise and interruptions of care. Parasomnias are sleep problems that are more common in children. These include sleepwalking, night terrors, nightmares, bedwetting, and tooth grinding. In box 31-3 in your textbook, you'll find a presentation of classification of select sleep disorders. Let's try another question. During rounds on the night shift, you note that a patient stops breathing for 1 to 2 minutes several times during the shift. This condition is known as A, cataplexy, B, insomnia, C, narcolepsy, or D, sleep apnea. The answer is D, sleep apnea. Anna is a 23-year-old nursing student assigned to the nursing home for her second semester in nursing school. She's had experience in nursing homes, having worked in one center as a nursing assistant during the last 2 summers. Anna's assignment is to care for Mr. Murphy over the next 4 weeks. What factors could Anna consider when preparing to care for Mr. Murphy? Anna needs to maintain Mr. Murphy's safety, teach relaxation techniques to promote sleep, and evaluate Mr. Murphy's diet, medications, pain tolerance, elimination habits, and routine to see if there is a culprit that's keeping him awake and impeding his ability to sleep through the night. It is not uncommon for almost any patient to experience some type of sleep disorder, especially if sleeping in a new place. However, it is important not to overlook the problem or consider it as normal. Use of critical thinking approach helps you to correctly identify the nature of sleep problem and initiate appropriate nursing care. Apply your knowledge, experience, and appropriate critical thinking attitudes and standards to make the correct clinical judgments for the patient. In box 31-4 in your textbook, you will find some examples of synthesis in practice. To make decisions about the nature and cause of a patient's sleep problem, it's important for you to synthesize knowledge regarding the physiology and functions of sleep and factors that affect it. Knowledge of the pathophysiology of select disease processes further helps in understanding the mechanisms for certain sleep problems. In addition, a thorough knowledge of pharmacological information is important because many medications that patients receive may contribute to sleeping difficulties. So, how can culture influence sleep? Well, infant care practices such as co-sleeping and the practice of regular siestas or naps are examples of cultural variations influencing sleep. You know of factors that have either disrupted or promoted your own ability to sleep? Think of those. This type of personal experience is valuable when assessing patient sleep problems or in selecting therapies for sleep promotion. Previous clinical experiences with patients help you to appreciate that environmental and lifestyle variations significantly affect the quality and quantity of sleep that a patient receives. Perseverance and discipline are important critical thinking attitudes to use to help develop a plan of care with effective solutions to manage a patient's sleep problems. The problems and the results from sleep disruption also often require creative approaches. When learning about a patient's sleep problem, you use numerous intellectual standards in conducting the nursing assessment. Professional standards such as the peri-anesthesia nursing standards or practice recommendations and interpretive statements offer guidelines for care patients with issues that have involving sleep, and they help patients by promoting sleep for patients while they're in the hospital. So let's take a look at the nursing process, starting with assessment. Because sleep is a subjective experience, only the patient is able to report whether it is sufficient and restful. If a patient admits to you or you suspect a sleep problem, gather a more detailed history. Aim your assessment at understanding the characteristics of any sleep problem and the patient's usual sleep habits, so you incorporate ways for promoting sleep into nursing care. Patients are your best resource for describing a sleep problem and any change from their usual sleep and waking patterns. Parents or bed partners often are able to offer information on the patient's sleep patterns that reveals the nature of certain disorders. Obtain a child's sleep history from their parents. Older children often are able to relate the fears or worries that prevent them from falling asleep. If a child awakens frequently in the middle of a bad dream, parents are usually able to identify the problem without necessarily knowing the meaning of the dreams. Parents can describe typical behavior patterns that encourage or impair sleep. When children have chronic sleep problems, parents relate the duration of the problem, its progression, and the child's responses. It is a good idea for parents of an infant to keep a 24-hour log of their infant's waking and sleeping behavior over a period of several days. You'll also need to obtain a brief sleep history from patients on admission. Determine usual bedtime, normal bedtime rituals, preferred environment for sleeping, and what time the patient usually rises to plan care to support his or her positive sleep habits and patterns. Assess the quality and characteristics of sleep in greater depth when you suspect a sleep problem. If you'll take a look at 31-2 in your textbook, you'll find information on a focused patient assessment. Begin the sleep history with the patient's self reported sleep pattern. An effective subjective method for you to use for assessing sleep quality is the visual analog scale. A scale commonly used to assess the degree of daytime sleepiness, or EDS, is the Epworth Sleepiness Scale. When a patient admits to you or you suspect a sleep problem, ask open ended questions to help the patient describe the problem more fully. Ask questions to discover the nature of the problem, signs and symptoms, onset and duration, severity, predisposing factors, and the effect on the patient. Ask the patient and the bed partner to keep a sleep wake diary when it's obvious the patient is having serious sleep problems. Assess for any physical or psychological problems that affect the patient's sleep. Assess a patient's medication history, including over the counter and prescribed drugs. A person's family situation or occupation offers clues to the nature of a sleep problem. If a patient is anxious, fearful, or angry, mental preoccupation seriously disrupts sleep. Ask how patients prepare for sleep. Assess their habits that are beneficial compared with those that disturb their sleep. You need to point out that a particular habit is interfering with sleep and help patients find ways to change or eliminate disruptive habits. After patients, um, ask well, ask your patients to describe their preferred bedroom conditions. Information about the sleeping environment will help you to design better sleeping conditions. Some patients are unaware of how their sleep problems are affecting their behavior. If sleep deprivation has lasted a long time, psychotic behaviors such as delusions and paranoia often develop. Older adults have a harder time falling asleep and more trouble staying asleep than do young adults. Sleep studies on older adults show a decline in REM sleep and an increase in nighttime awakenings. Circadian rhythms that coordinate activities such as sleep change as the body age. It is a common misconception that sleep needs decrease with aging. Older patients become sleepier in the early evening and wake earlier in the morning, but still require the necessary 7 to 8 hours of sleep a day. Research suggests that much of a sleep disturbance in the elderly is attributed to physical and mental illness and medications used to treat them. Since increased age is associated with an increased incidence of chronic medical conditions, assessing for those associated with sleep disturbance is important. The elderly frequently experience losses, such as retirement and death of a loved one, which may lead to emotional stress or depressive mood problems that affect their sleep quality. After assessing a patient's sleep history, determine his or her expectations regarding nursing care. Use a caring and skilled approach to assess the patient's sleep needs and preferences. The patient sometimes has a different view about the relationship of sleep and health from your own. In the hospital settings, some patients are more concerned about being sure that you are checking the condition routinely than about whether you wake them and disturb sleep. So let's look back at our case study. As Anna prepares to conduct an assessment of Mr. Murphy, she knows it is important to consider how sleep is altered in older adults. Because they typically have less sleep, deep sleep, and more awakenings, it will be important to consider what factors in the nursing home disrupt sleep. She has learned that his osteoarthritis pain is a contributing factor to the sleep disturbances. His immobility from the stroke adds discomfort. Anna also plans to assess Mr. Murphy's medications carefully to determine whether any drugs are adding to the sleep alteration. So, what are some other things that Anna might need to consider? Anna should also consider that a nursing home resident's sleep is often fragmented. Other factors that affect sleep in a nursing home patient are physical illness, dementia, depression, high prevalence of sleep disordered breathing, chronic bed rest, circadian rhythm disturbances, and the noise and lighting of the environment. Anna determines there are also environmental stimuli disrupting his sleep. Anna evaluates whether a roommate or visitors are a factor, the presence of electronic equipment at his bedside, and the likelihood of noise coming from an outside hall. Anna plans to include Miss Murphy in the assessment to learn more about her perceptions of changes in Mr. Murphy's behavior. Anna plans to talk with Mr. Murphy more than once to gather the necessary information and to keep her patient from becoming fatigued. Here are Mr. Murphy's responses. Mr. Murphy was asked the following questions. Please describe the nature of your sleep problem. Do you awaken during the night? Can you rate the quality of last night's sleep? Please describe your usual bedtime routine, and are you having any trouble that is contributing to your sleep problem? Mr. Murphy says that it is probably taking him about an hour to get to sleep. He says that he is awaken frequently. No one can sleep around here, he said, and something is always going on. Mr. Murphy estimates he got about 4 hours of sleep the night before. He estimates it as nearly the worst night of sleep he has ever had. At home, Mr. Murphy usually slept from about 10 p.m. to 6:30 a.m. He says he rarely had trouble getting to sleep, and his wife says that he listened to music to help him relax. Mr. Murphy says that he's having some pain from the osteoarthritis and he's having trouble changing his position and getting comfortable. Mr. Murphy is yawning frequently and shifts his position in the wheelchair during the assessment from the nurse. So, what diagnosis do you anticipate? Well, Mr. Murphy has experienced sleep deprivation secondary to insomnia. Listed here on the slide are some other nursing diagnoses that can be used for patients that are having sleeping issues. Your assessment is going to reveal a cluster of data that's going to include defining characteristics for a sleep problem, and that will help you choose the appropriate nursing diagnosis. If you identify sleep pattern disturbance, it is helpful for you to specify the exact condition. By determining the nature of a sleep disturbance, you can design more effective interventions. A list of potential nursing diagnoses again are listed here on your slide. Your assessment also will need to identify the probable cause or related factors for the sleep disturbance, such as a noisy environment, a high intake of caffeine, or stress involving work. The cause becomes the focus of interventions for minimizing or eliminating the problem. So let's look back at the study. So we said he was going to have the sleep disturbance due to the insomnia. And his goal is that Mr. Murphy will attain a sense of restfulness after sleep in 1 month. So, what are some expected outcomes that you will see that apply to this goal? Some expected outcomes for Mr. Murphy are that he will have fewer than 2 reported awakenings during the night. Mr. Murphy will report being able to fall asleep within 30 minutes of going to bed, or Mr. Murphy will sleep an average of 7 hours a night. After identifying all the relevant nursing diagnoses for a patient, you develop a plan of care. You develop an individualized care plan only after you understand how the nursing diagnosis relates to your patient's normal and current sleep patterns. His or her perception of the sleep problem and the factors disrupting sleep. Together, you and the patient develop realistic goals and outcomes. For example, the goal of the patient will establish a healthy sleep pattern includes outcomes such as patient falls asleep within a half an hour of the planned time, patient has less than 2 awakenings during the night. The outcomes will serve as measurable guidelines to determine goal achievement. There's a care plan in your book for insomnia, and there's also a figure 31-3 that shows you a concept map for this issue. Together, you and the patient identify and select the strategies and interventions that are more likely to be beneficial in the home or healthcare setting. In a healthcare setting, you plan treatments or routines together to give the patient more time to rest. Again, in a healthcare setting, you plan treatments or routines together to give the patient more time to rest. In a nursing home, some plan rest periods around the activities of other residents. The nature of a sleep disturbance determines whether referrals to additional health care providers are necessary. For example, if a sleep problem is related to a situational crisis or emotional problem, then refer the patient to a psychiatric, clinical nurse specialist, pastoral care professional, or clinical psychologist for counseling. Sharing information with a home care nurse on patient discharge is useful in planning interventions to ensure that the patient gets adequate sleep when he's at home. So let's continue on in the nursing process with implementation. Patient needs adequate sleep and rest to maintain active and productive lifestyles. Your specific interventions will promote a person's normal sleep and rest pattern. All patients require a sleeping environment with a comfortable room temperature and proper ventilation, minimal noise, a comfortable bed, and proper lighting. In box 31-5 in the textbook, you'll find information on sleep disturbances in older adults. Bedtime routines and sleep hygiene measures relax patients in preparation for sleep. To develop good sleep hygiene at home, patients and their bed partners need to learn techniques that promote sleep and conditions that interfere with it. In box 31-6 in your textbook, you'll find an example of a patient teaching for improving sleep. People will fall asleep only after feeling comfortable and relaxed. Recommend and use measures designed to promote comfort, such as voiding before bedtime, wearing loose fitting nightwear, using extra blankets to prevent chilling, wearing supportive splints, or using extra pillows for support. In the home, encourage patients to stay physically active during the day so that they are more likely to sleep at night. When patients feel emotionally upset, urge them to try not to force sleep, otherwise, insomnia often develops, and soon they will associate bedtime with the inability to relax. Encourage a patient who has difficulty falling asleep to get up and pursue a relaxing activity rather than staying in bed thinking about sleep. In box 31-7 in your textbook, you'll find information on patient centered care related to co sleeping. Some people enjoy bedtime snacks, whereas others cannot sleep after eating. A bedtime snack containing protein and carbohydrates such as cereal and milk or cheese and crackers, which contain tryptophan, may help promote sleep. Coffee, tea, colas, and alcohol act as diuretics, which cause nocturia. Many pharmacological sleep aids are available, including melatonin, sedatives, hypnotics, non-benzoid diazepines, and benzodiazepine receptor antagonists, and melatonin agonists. Regular use of any sleep medication leads to tolerance, and withdrawal causes rebound insomnia. Make sure that all patients understand the possible side effects of sleep medications. Routine monitoring of patient responses to sleeping medication is important. Patients who suffer specific sleep disturbances likely benefit from the health promotion strategies and discussed so far. Weight loss can be effective for patients with OSA. It is important for the patient to follow an appropriate weight reduction plan. In milder cases of OSA, body position during sleep is effective. So let's another question. A patient suffers from sleep pattern disturbance. To promote adequate sleep, the most important nursing intervention is to A. Administer a sleep aid, B. Synchronizing the medication treatment and vital sign schedule, C. Encouraging the patient to exercise immediately before sleep, or D. Discussing with the patient the benefits beginning a long-term nighttime medication regimen. The answer is B. Synchronizing the medication treatment and vital sign schedule. So back to our case study. The nurse evaluates Mr. Murphy's progress every week and implements interventions on the slide. So, some of the interventions were to sit next to the window 30 to 60 minutes each morning, discourage daytime napping, have an egg crate type mattress placed over his normal mattress, encourage Mr. Murphy to decrease his fluids to 2 to 4 hours before sleep, and arranging for Mr. Murphy to have a CD player with headphones when he goes to sleep. And you'll find the rationales for those interventions next to it. Each of these nursing interventions help promote relaxation and comfort to improve nighttime sleep. The nursing interventions described for health promotion are applicable to a patient requiring acute care. The nature of the acute care setting requires you to be creative in finding ways to maintain the patient's normal sleep pattern. In box 31-8 in your textbook, you'll find evidence-based practice information on sleep. Because many patients spend only a short time in hospitals, it's easy to forget the importance of establishing good sleep conditions. In a hospital setting, control noise as much as possible and plan nursing care activities to avoid walking patients. Safety precautions are important for patients who wake up during the night to use the bathroom and for those with EDS. You make the patient more comfortable in an acute care setting by providing personal hygiene before bedtime, changing or removing moist dressings, repositioning drainage tubing, reapply wrinkled thromboembolic hose, and changing tape on nasogastric tubes eliminate constant irritants to the patient's skin. The quality of sleep in a long-term care or nursing home environment is often fragmented. Residents of the nursing home often suffer chronic disease, incontinence, and dementia, and take multiple medications, all which can disrupt sleep. In the long term care environment, many patients require rehabilitations or supportive care. The nature of the illness and treatment requirement disrupt sleep. In the restorative care setting, try to limit the time patients spend in bed. Knowing the many factors that disrupt sleep in restorative care settings, you find ways to make the environment more favorable, and noise control is critical. So let's look back at the case study. Anna asked Mr. Murphy to use a rating scale for the quality of his sleep at the end of each week. After 1 week, Mr. Murphy rates his night sleep at a 6 out of 10. At 2 weeks, an 8 out of 10. Anna asked Miss Murphy to evaluate her perception of Mr. Murphy's level of fatigue. She says he is more alert, awake, and talkative during her visits. Anna asked Mr. Murphy at the end of 4 weeks to keep a record for a week of length of time he estimates he sleeps. At the end of the month, Mr. Murphy is falling asleep within 30 minutes of going to bed, and he gets up 2 to 3 times a night. He estimates that he gets around 6 hours of sleep. So, what would you guys write in a documentation note to verify achievement of outcomes? Well, a sample nursing note could be that the patient reports improved sleep 8 out of 10. Patient reports falling asleep within 30 minutes of going to bed, getting up 2 to 3 times a night, receiving 6 hours of sleep at night. Patient is more alert, awake, and talkative. Individualize your evaluation therapies designed to promote sleep and rest. In box 31-9 of your textbook, you'll find an example of evaluation. If you've established realistic goals of care, the expected outcomes become guidelines for evaluating a patient's progress in response to interventions. Use evaluative measures shortly after trying a therapy. Use other evaluative measures after a patient awakens from sleep. Together, the patient and the partner can usually provide accurate information if the patient lives or sleeps alone. The evaluation may be unreliable. When a patient does not meet expected outcomes, revise the nursing measures based on the patient's need or preferences. Document his or her response to sleep therapies to maintain a continuum of care. Review the progress in the plan of care with your patient and determine if his or her expectations were met. Does the patient believe that your interventions were helpful and useful? The patient's perceptions are valuable sources of information regarding the overall success in improving the quality of your patient's sleep.